Okay, I guess we'll go ahead and start. I think they had another lecture with Dr. Stephanus, I believe.
Yes, they did.
All right. So is the sound okay?
It's perfect.
All right. All right. So good afternoon, everyone. Sorry, it's like the last one in the day. I think some of you may have something after, but I'm sorry about this morning. I had an urgent assessment at the hospital, so I could not make it in time. So now we're going to talk about emotions. Like I said, we have 2 lectures left, emotions and aggression and violence. I'm going to see if I can fit them both. If not, then I'll try to find another half hour, maybe this week or beginning of next week to finish, okay? All right, so generally, emotions and feelings. I believe you guys had a lecture with Dr. Jaratli about depression, which is, you know, kind of the negative feelings. Here we want to look at sort of the more positive ones and try to understand them. So basically, feelings do add color to life. I mean, if you imagine life without feelings, then it's just very bland and plain, even if they're negative ones. Sometimes patients talk about alexithymia, which is they feel absolutely nothing, right? That is a lot more distressing to them than feeling depressed, you know, because at least depression is something, it's a feeling, okay? Humans, more than other creatures, will experience a variety of feelings, you know, whereas more primates or animals, it's more about fear and it's about survival. But for humans, you have a diversity. And we know that anxiety presents with somatic symptoms. And the reason it's important to remember that is a lot of times we see patients presenting only with somatic symptoms with no ability to express that they're anxious. So they present with abdominal pain, headaches, general body aches, and again, this could be culturally driven, where in some cultures, and I'm sure this was covered by Dr. Ali, in some cultures that are not very expressive about how they feel, they present primarily with somatic symptoms. So again, there's psychosomatic psychiatry or consultation liaison psychiatry looking at symptoms that are somatic and kind of tracing it back to you know, a diagnosis of whether it's anxiety or depression or other. So what is the theory of emotions? So they're pretty much a mix of, there's physiological arousal, okay, expressive behaviors, and then these consciously experienced thoughts and feelings. So it's a triad, okay, between your thoughts, your feelings, and your interpretation of them, okay? The physiological arousal is something that's innate, you know, palpitations, sweating, you know, feeling like your tummy is uncomfortable. It's a physiological arousal. And then how that is interpreted in your mind, and then I'm sure that was discussed also by Dr. Ali, and just tell me yes or no, when he talked about like the theories of depression and how you have this triad. And then when you want to implement treatment, you have to kind of break that cycle, you know, where you tackle either, you know, the arousal symptoms, or you tackle the expressed behaviors, or you tackle the thoughts, okay? But there's kind of controversies about, you know, what comes first. So you have the chicken and egg debate, which says that, okay, somebody said, yes, we took it, perfect. Makes life easier. So the chicken and egg debate, it's like, do you have the physiological arousal first? Okay. Or do you have the emotional experience? Like what comes first? Okay. Obviously there's kind of this interaction, and does cognition precede emotion? So do you feel something and then think, or do you think and then feel, or do you have the arousal first? So, you know, what happens exactly? Okay, so there are people who came along who tried to kind of, you know, put that in words. And so we have different theories around kind of how emotions develop, okay? So common sense will tell you that you cry when you're sad, or you lash out when you're angry, or you tremble when you're afraid. So that's kind of your behavior that's associated with a feeling, okay? So James Lang, their theory was that you first have a distinct physiological response, okay? Then you have the emotion. So he says, or they say that, imagine if your car skidded, so you're driving, and then the car loses control, all right? And then you gain control. So initially you have these palpitations, okay, your heart is racing. Then you start to feel like you're shaking with fright. So the fear followed the physiological response. That's their theory. Came along another bunch, and so they said that the body's responses are not distinct enough, okay, to evoke different emotions in people, okay? Because a racing heart palpitations could be fear, could be anger, or love. So all of these different emotions will instill the same kind of physiological response, okay? So they believe that physiological arousal and the emotional experience occur at the same time, okay? So that the emotion triggering stimulus, the stimulus, okay, kind of goes to the cortex and it causes this awareness of an emotion, but then causes a body arousal, right? So the theory implies that the heart starts to pound as you experience the fear and that not one causing the other. So these guys say that they happen simultaneously. Another group says that your physiology and your cognition, so cognition is like your perception, your memory, interpretation, together will then create the emotion. So they're kind of adding another step in there, which is your cognitive interpretation of your physiological response, okay? By physiological response, yeah, so heart rate, sweating, so that kind of stuff, which is not under your control, okay? So when you're afraid and you have palpitations, it's not something that you thought about. You just have palpitations. And then so some people say that your palpitations then cause you to have that fearful response. Some people say you have the palpitations and the fear together. And then this group says that you have a physiological response, palpitations, with an interpretation, okay, followed by this kind of the emotion, all right? So he says the emotions or the experience of the emotions comes from an awareness. So you have palpitations, your body interprets them, then comes the experience of the emotion, okay? So I put that kind of in this grid here. So you have an example of an incoming car. So a car is coming right at you, that's the stimulus. The first group says that the pounding heart, okay, causes the fear. So you have the palpitation then is followed by the fear. The second group says that the pounding heart, which is the arousal, and the fear, which is the emotion, co-occur simultaneously. The third group says that you have a pounding heart, then there's a label of I'm afraid as a thought, then there is an experience of the thought, an experience of the emotion. Okay, so that's kind of how they are different. But again, you know, when you have somebody who's presenting with anxiety, right? Now, we always trace backwards. We try to look for what is the cause. Remember when we talked about, you know, looking at behavior. And so you look at not only the consequence, which is the fear, but you want to look at what led up to it. Like, why now is this person feeling this way? A lot of times, even when you trace backwards, you cannot really find, I don't get the two-factor. Right? So the two-factor is, the difference between the two-factor and the cannon board is that with the two-factor, you have a thought that precedes the feeling, okay? Whereas in this group, they say you have the arousal and the emotion at the same time. Here, they're saying that there's another step. So you have the arousal, then you have a thought that's then followed by the fear. Now, when we have, if we think about anxiety in this sort of way, that means that we can actually interrupt, we can do a cognitive intervention to relabel the arousal. So that if someone says like, you know, every time I walk into this plane, my heart beats, we're gonna crash. So I'm afraid of getting onto this plane. Okay, so we kind of, this is called distorted thinking. Okay, so this cognitive label here is distorted because palpitations, it just people associate. Remember when we were talking about how you can associate a feeling or like if you have a kind of this physiological response to a place, and so you develop anxiety from the place. So the first time you get a panic attack is when you're in the car. So therefore you associate the palpitations or the feeling of that you're going to die with being in a car, okay? And so you start to develop avoidance. You start to avoid getting into cars. And so the objective would be to kind of really target the cognitive label, because if you can eliminate that, then that is a better control of the fear than just controlling the physiological arousal. So if I give someone with anxiety a beta blocker, okay, so that should help with their palpitation, but it's not going to help with their cognitive label. So I'm not really treating the problem. I'm just putting like a Band-Aid on it. I'm kind of suppressing it, if you will, but it's not a treatment. The treatment is really to tackle the cognitive label. Okay. So does CBT use the two-factor approach? Again, CBT is a complex mechanism of intervention. Which factor or which method does it use varies, but again, I just want you to understand the concept. So the concept of any cognitive intervention is looking at the cognitive distortions. What is the cognitive label behind the feeling, all right, and behind the physiological arousal. Okay, so why do I tie palpitations to an airplane and then with fear? And so therefore, I can give an SSRI to tackle the fear. I can give a beta blocker to tackle the palpitations, okay? But again, the ultimate treatment would be to actually focus as well. I'm not saying only, again, depending on the level of fear. Sometimes the fear is so intense that, a person's not even open to any sort of cognitive intervention. And that's part of the assessment that we do. How ready is this person for dealing with their, cognitive distortions, depending on the level of anxiety. And so a lot of times we have to go in full force, SSRI, maybe a beta blocker, as well as CBT, the combination, because eventually you don't want to have people on treatment for all of their life. That's not the goal. The goal is manage it, get them to kind of, have better ways of dealing with cognitive distortions, like they learn techniques, so that they can then apply them should, they have some other kind of arousal in another situation, so they can generalize what they've learned. Okay. Again, this is something that you're super familiar with. What happens when you have the sympathetic arousal, and then when things calm down, when you are calm, how everything, your parasympathetic system kind of, helps you just relax. And so the anxiety, the feeling of being anxious is less, because all of these stress hormones are much less. Okay. So what are the physiological similarities among some specific emotions? All right. So some emotions, although may be different, may not have very distinct biological signatures. Okay. So for example, fear, anger, sexual arousal may have very similar biological parameters, but obviously they look and feel very different. Fear and anger being more negative and versus sexual arousal, which is not. Okay. However, they share palpitation, sweating, very similar biological parameters. Okay. But there are some also very real physiological distinctions among emotions. Okay. So although we have fear and joy, which are the complete opposite ends of the spectrum, they produce increased heart rate. Okay. But they actually stimulate different facial muscles. All right. So although the biology of it is similar, but the mechanism is going to be different. So during fear, your brow muscles really tense up, whereas during joy, muscles in the cheek and under the eyes, they'll pull the face into a smile. Although if you check heart rate, in both cases, it's going to be increased. So emotions obviously then differ in the brain circuits that they use. Okay, so if you watch,
my classes, it's okay.
Is everybody okay? All right. So if you watch fearful faces, okay, that will show that you're going to have an increased activity in the amygdala. So the amygdala and fear are connected. Okay. There's a tendency for negative emotions to be linked to the right hemisphere and positive emotions to your left hemisphere. Disgust, which is feeling something really bothers you to the point of being disgusted, it triggers more activity in the right prefrontal cortex than the left. Depression-prone people show more right frontal activity. Positive mood tends to trigger more left frontal lobe activity. Like we said, negative is more to the right and positive is more to the left. So again, more and more we realize that our experienced emotions are also involving our cognition. So how you think about things can color how you feel about them. So your kind of instilled thoughts can really color how you also feel about something, or how you, like, the vibe that you get from it. Okay. So what is the connection between what you think and how you feel? So cognition can really define your emotion. So sometimes our arousal response to something spills over into your response to the next event. Okay. So you are like, you walk in today and you're like tense. Okay. So that's going to spill over into pretty much most of your day. If you kind of start off your day not feeling well, you end up kind of not having a good day. All right. Emotions can be experienced differently depending on how we interpret them and how we label them. Okay, so again, not having a good day, depending on how extreme you are in terms of how you cognitively label it. So today is going to be like a disastrous day, is like a very catastrophic way of looking at that emotion, versus someone who says, well, I'm hoping that it's not going to continue. So again, how you think about it can really also flavor how you feel about it. If someone is aroused and then provoked, okay, so you're kind of tense and then somebody pushes your button, okay, your response is going to be so different than if you were not aroused. So if you come in and you're chill and you're calm and something bothers you, it's not going to be as inflamed as if you're already all hyped up. Okay, so that obviously makes sense, because sometimes people are kind of tense and small things provoke them that if they were not tense, it wouldn't. Okay, and even that way, it's described by patients and saying, I'm not sure why I lost my cool. What happened didn't really deserve the response that it evoked. Okay, so again, your arousal status can also flavor your response. So arousal fuels the emotion, and your cognition, how you think about it, channels it. So it can either channel it into something absolutely catastrophic, or it can channel it into something, that will help you kind of calm down or make it okay. So it's a very interesting connection. So we may have, is our brain capable between feeling nervous and feeling excited? So again, it's the feeling, okay, is going to be like the same, but it's the cognitive interpretation that will be different. Okay, because if you're nervous and you're excited, you're going to have probably palpitation. Your sympathetic system is on the up. All right, but what does that mean? Like, you're all like hyped. So how does that feeling, how is your brain going to interpret it, is what's going to sort of dictate between, being nervous or being excited. Okay, sometimes we may have emotional reactions even before we interpret a situation. Okay, so for example, you're in the middle of a conversation, all right, you're all like really into it, and then you remember, oh my god, like I have my BHS deadline is like in an hour, for example. Like you have this really important deadline, all right, but then you're so into the conversation that you kind of get distracted from the bad news, all right, but then you kind of still bad. What they're saying is that you may still kind of feel bad, but you kind of forgot, and you can't put your finger on the reason. Okay, so the arousal lingers without the label. The label is I passed my deadline. So the arousal continues. Okay, and that happens to us in life. You're in the middle of something and something hits you, like something that's not pleasant. You can still continue your day. You can still go on. You may not continue the day feeling great, but again, you may have forgotten the particular reason because you have to focus. Like, it's not like it's gone from your memory, but it's not in your immediate focus. But what happens is the emotion of just feeling like blah or kind of uncomfortable may continue. All right. Then obviously you remember when you kind of sit and try to, say what happened today and why am I feeling so like not so great. But also you can say that it may not always precede emotion. So you see, what happens is people talk about, like controversy. So some people would say it does, some people would say it doesn't, and each has an argument that could be valid, okay? So if someone kind of subliminally flashes a stimulus at you, all right, so like a smiley face or something that's negative, okay, that can prime your mood or a specific emotion, and that could lead you to feel better or worse, okay, about a follow-up stimulus, okay? Have you guys seen the movie Focus for Will Smith? Okay, so what it does is there's the subliminal number 50. Okay, so kind of you get that 50 subliminally, you can kind of, what's the word? You can prime someone with subliminal stimuli that will affect their judgment or decisions, if you will. It will affect their mood, and therefore it could affect their decision. So they had this experiment with 30 thirsty people, okay, who were given a fruit-flavored drink after they saw a subliminally flashed face. So sort of a face, you know, in the room, like flashes on a TV screen. So not something where someone says, hey, look at that. So it just kind of is in the background. For those who were exposed to a happy face, they found that they drank about 50% more of this juice than those who were exposed to a neutral face. Their behavior, okay, was actually driven by the subliminal mood of being comfortable or being happy because they saw something that was nice, okay? So it means that some emotions can actually bypass the cortex completely, where you actually think about them, and they go directly to the amygdala where you actually just feel them, okay? So the amygdala can send more neural projections up to the cortex than it can receive back, okay? And so this makes it easier for your feelings to hijack your thinking so that you feel about things without actually kind of going through the thought process. Because when you think about things, that's when you can put a brake on your feelings, okay? So sometimes in situations, someone tells you, don't feel, try to think. Because when you think, you can make a better decision. But if you just rely on how you feel, it completely eliminates your problem solving, because you're just going with the feeling. And that's what happens when people fall in love, is, you know, if you're driven by just how you feel without the thought of, okay, is this a suitable person? Am I making the right decision? Is this the right time? You know, all of that thought process is completely eliminated when somebody just, like, you know, completely falls for someone else. So for people who saw a neutral face, the emotion goes directly. No, it's not about it going directly or not. It's just what they're saying is these subliminal things in your environment can prime you. Okay, they can kind of gauge your behavior. So if you see positive things, or that things that kind of mean positivity, whether it's smiley or something that smells good, or if it's an organized room, like even if you, let's say you want to study, right? And if your room is a complete mess, the feeling that you have about studying is not going to be the same as if, you know, it's a completely, you know, organized room with flowers and lighting. Your feeling is going to be affected. And so that's why there's a whole thing about, you know, what color do you paint your room, because that can kind of instill a certain mood in your office. You know, what kind of things do you have that will kind of help you to kind of work better, you know? So all of these things, they're not really direct, you know. There's nothing that says, you know, having a whatever color is going to promote you. It's all personal, you know. If you like the color, you know, whatever, and that's in your environment, it kind of puts you in a better mood and sets you up for, you know, better concentration. So it's kind of interesting to look into your environment and see what works for you. You know, some people like clutter, some people work better in clutter, some people don't. So whatever works for you, but think about things as how they could be subliminal. So because they have a positive feeling, it affects their behavior. So they found that they just drank more because they felt better. Okay. So again, our brains process and react to a vast amount of information, not necessarily with your conscious awareness. Okay. Some emotions don't require conscious thinking. Okay. So it kind of bypasses the cortex. And again, when you do CBT, you're trying to bring these emotions into conscious thinking. Okay, so when someone tells you, this happened and I felt that way, we always try to bring it to the here and now. And what were you thinking? How was that affecting how you were looking at things? So trying to always put bringing the thought in it can put a break on, things that are blown out of proportion. So, and again, it happens. You do something and then someone's going to tell you, like, weren't you thinking? Where was your brain at the time? Okay, when you did whatever you did, So again, it's layman term, but it also tells you that a lot of times we do things because we're driven by an emotion and we don't give enough time for the cortex to kind of put a break on. But also, you have spontaneous things. You want to be a spontaneous person who goes with how they feel. So, artists are very spontaneous. They don't have a lot of breaks because, putting a lot of thought into the art make really limit it and not make it as expressive or as like spontaneous. Okay, so expressed emotion is a really interesting and important thing for us in mental health, and I'm not sure if you took that with schizophrenia. Did you ever hear about expressed emotion, like environments where you have high expressed emotion? Have you heard that term before? It's called high EE, so high expressed emotion. Okay, so that's good. So how do you communicate non-verbally? Okay, so sometimes your behavior will reveal your emotions. So this non-verbal language really varies with culture, or it could be universal. So there's some things like, a smile is a smile. It's going to be interpreted as a smile no matter where you go, no matter what you do. A smile is a smile, okay? So when you're hearing emotions conveyed in other languages, you can easily detect anger, okay, in tone, right? You don't know what they're saying, okay, but you can detect it in tone, you can detect it in body language. So we're very good at detecting threat. And why do you think that we're very good at detecting threat? Why is that kind of an intuitive thing for us? Like you're walking down the street, somebody's walking near you, but the way they're walking, like they're kind of fast paced, they're heavily breathing, so they didn't really threaten you, but they're nonverbal, kind of you detect threat. So it's really for protection, yes. So this gut feeling is really important to follow, and I tell that to my residents. So when we're interviewing a patient that is presenting with whatever, they're paranoid, they have a positive history of hallucinations. So there's something in their history that's not just, saying that they're having difficulty sleeping. So this is somebody who's got something happening. So I always tell my residents, you really have to follow your gut feeling. If you're not feeling comfortable, then you may need to end an interview, or you may need to make sure that there's an exit. Okay, so I had a 14-year-old patient a few weeks ago being interviewed by one of our psychology interns, okay? And so this girl has had a recent change in her behavior for a few months, where she started to have, paranoid delusions, hallucinations, and she's talking to herself about events, and she believes that these things, so she believes that she got married, she believes that she moved to Paris, so things like that, right? So generally, when we talk to kids, we can kind of approach them, so we may reduce the interpersonal space somewhat, just to make them feel like, more comfortable, not keeping a huge distance, especially if, you're still trying to get to know this child. But I mean, every time the student got closer to this girl, the girl's eyes were like, screaming of, I'm afraid, I'm scared, right? But this intern didn't notice that, okay? So obviously the teaching here was, you're getting closer. This girl looks like she's more and more afraid because she doesn't know who you are. You could be, involved in the delusional system that she has. So what could happen? What could this girl do? What do you guys think, could happen here in this situation when you're getting closer to someone who's feeling really scared because they don't, yeah, so obviously they could attack the interviewer, okay, as part of self-defense. So that intern could have, received quite the blow on her face or on her, body, like she could have been kicked or hit by this 14-year-old. Okay, not really a panic attack, because again, we're talking about somebody who's psychotic. So psychotic, they're going to be delusional, and so part of it is the paranoia is I'm going to be attacked. So they're going to attack back. So they're going to push or going to attack. So it's very important to follow that kind of gut feeling, the nonverbal stuff, okay? Also, your experience can sensitize you to a particular emotion. Is our gut feeling always true? It's a good question. I think it's something that you develop over time based on experience, because again, your experience can sensitize you, okay? It can guide you, okay? If you've seen that many, psychotic patients, you get a general sense of what it's like for them too. And so you can understand. If you're somebody who lives downtown New York, for example, or like where I live, downtown Vancouver, a lot of drugs and alcohol on the street, you develop a sense of, again, it's not like you're afraid, but you can detect threat based on, what you see, based on what you hear in the news, people get mugged. So that kind of experience really can sensitize you, okay? So they say that exposing different facial parts, okay, shows that the eyes and the mouth tend to be the most revealing. Okay, your eyes and your mouth as part of your face are the most revealing, okay? So that fear and anger are read mostly from the eyes and happiness mainly from the mouth. And if you remember when we did our very first few lectures about, infant social development and why it's so important for, the kids to see the triangle, so your eyes and so the central part, because that's how they can start to learn to read faces. So when you read a face, then you start to understand, again, to comprehend the feeling behind what you see. Okay, so when I see kids, and again, I'm talking based on my specialty, a 14, 15-year-old who comes in who's complaining from depression, I ask them to remove their veil, because it's really important for me to see their facial features. I think with mental health more than anything else, because they're talking about how they feel. So you want to see, does the feeling that they describe match what they see? Because sometimes you have mood disorders that are non-congruent. So you can have somebody who's, manic and who's talking about a content that doesn't match what they look like, or vice versa. So you need to see someone's eyes, you need to see their mouth and how they respond to, the conversation that you're having. All right, but sometimes it's still difficult to detect deceiving expressions, okay? So sometimes you may not really read the person in front of you. Not all of us are really good at reading what's going on. And some people are very good at putting on a face, like that poker face, right? Where you can't really read them. We say it's like completely apathetic, completely flat. And so you don't know what's going on with them. And they could be normal people, not necessarily someone with a mental health issue. I'm sure you've met people that you just don't know how to read, okay? So their facial expressions just are very deceptive. Now, is that conscious or not? More so, it's not a conscious thing that people do, right? Some of us may be very sensitive to physical cues. Some introverts tend to excel at reading others' emotions. So people who are not the extrovert, they may read emotions, but again, are they reading them right or are they reading them wrong? Depends on, their cognitive interpretation. An interesting point here is when you send someone an email, sometimes people misread emails because obviously you cannot see facial expressions or tones of voice in an email other than, exclamation marks or question marks or, dot, dot, dot. So those are kind of, and thank God for emojis, like with other social applications, but we don't have that really in emails. But you can't really tell someone's emotional state. Flat face could be a sign of power. All right. is is it a sign of power always? I've seen people come in and complain that they don't have friends. Okay, they really complain from lack of interpersonal familiarity, a lack of warmth. People can't connect to them because of that flat face. Okay, so whether it's a sign of power, I see it more as defense against something, and it could be, an obstacle to forming, healthy relationships. Because people, when you can't read someone, you tend to shy away from them, because it's not comfortable. When you're sitting, it's not a very comfortable feeling. So, you tend to kind of actually move away. So they may more complain that people don't last, their friendships or relationships don't last. Okay, so women tend to have an increased inclination to read people's emotional cues. And so that's why, again, I'm not saying that, again, we can't generalize and say women are more empathic, but again, it's a skill. And so this nonverbal sensitivity may help them explain people's emotional sort of literacy. And maybe, subhanAllah, it's mothers, again, who are more intuitive in reading their children's emotions. Again, we can't generalize because there are some moms who just can't, who don't, okay? So this is a skill at decoding other people's emotions, and it may contribute to their greater emotional responsiveness in both negative and positive, okay? And then anger strikes people as being more of a masculine emotion. So if you're angry, that's more of a guy thing, okay? Also, people are more likely to see anger on men's faces. Even if it was a gender-neutral face that looked angry, they'll interpret it or perceive it as being male. Okay, so these are just interesting concepts. Okay, so when surveyed, women are more likely to describe themselves as empathic compared to men. They tend to experience emotional events more deeply. Okay, so it seems like there's more brain activation, and they may remember scenes 3 weeks later. So if you kind of hurt a woman, she'll never let it go. It's going to be within her forever. So we tend to kind of keep that emotional memory. Maybe men tend to just it brushes off, they kind of forget. I'm not belittling either. I'm just saying that, it seems that, the difference in how, genders function could be different. Okay. What about culture? Okay. So these nonverbal expressions of emotion, are they universally understood? So we said a smile is a smile around the world, regardless of your culture, as well as anger, okay? But then, there are other things, like, for example, clapping, okay? In some cultures, it means worry or disappointment. My grandmother, when she's praying, if she claps, it means stop, don't move, So that was my understanding of when she clapped, is she wants to say something, so don't leave the room. I'm not sure how true this is, if it's positive. We all know that thumbs up is positive. I'm not sure in what culture would it be seen as negative. If it's the thumb that's up, it shouldn't be a negative. How come some people are better at not expressing their emotions? Okay, so yeah, it could be sarcastically, thumbs up, depending on the context, true. I'm not sure if it's a better thing or not better thing, I like to look at things in context. So sometimes it's better not to express the emotion depending on the situation, okay? You go to an interview and things don't go well, okay? Crying, although maybe internally you're dying, but crying in the interview is definitely not a good thing to do. So keeping that in and kind of being bold about it, and not showing, is definitely the right way to go, okay? But in a time where you need to express the emotion because somebody passed away or a close friend is going through a really tough time, and you're not able to because you're there flat, it's not really a sign of strength. It's more like you're not able to, okay? But you have to always interpret things in context. So one thing in a context could be great, but the same thing in a different context could be completely disastrous, all right? So weigh it out. So children's facial expressions, okay, even those blind, even if a child is blind who's never seen a face, could also be universal. So blind children will smile. How do they know that they should smile, right? So that's kind of an expression they've never seen, but it's universal, okay? So blind people from birth will still exhibit facial expressions that are associated with basic emotions. We've done basic emotions, remember, in the first, like 6 months to a year of life. So joy, anger, disgust, fear. So we also tend to interpret faces in particular contexts, okay? So if someone looks like they're afraid in a frightened situation, we're going to say that maybe they look angry, whereas they could look fearful if it's in a painful situation. So the facial expression may not vary, but the context is different. And so then you could interpret it according to that situation. So if the situation instills fear, then you're going to say that person is afraid. Or if it's a sort of a situation where it could instill anger, you're going to say that person's angry, okay? So for basic emotions, we share universal facial sort of features. However, the level of emotion is going to be variable. Like, so Middle Easterns are very, extremely expressive. So anger and happiness are like to the extreme compared to Northern European, Scandinavian, where the level of expressed emotion may not be as intense, okay? Some cultures encourage people to adjust to others with emotions being less visible. And again, culture, in more in the Arab cultures, sometimes you're taught to curb your emotion. If you're happy and you're hyped up, people say relax. It's not really socially okay for you to be jumping up and down because you're excited. So cultures can also kind of curb expression of emotion. Okay, so you have biological influences, things that affect your emotional expression. So that's biology. Then you have the psychological influences, whether it's cognitive labeling or gender differences. And then you have all this social, cultural stuff. How expressive can you be? People around you, cultural expectations. So all of these really go into this one pool. Obviously, it'll go up and down depending on all of these variables. Okay. So do facial expressions influence our feelings? Okay. So we're trying to look at it from a different angle. So expressions communicate emotions, but they also amplify them, okay? So some talk about how you can control emotions. So going through the outward movements, if you will, of an emotion. So if you want to feel cheerful, all right, you kind of hype yourself, you sit up cheerful and you look around cheerful. And so therefore it kind of accentuates the feeling of being, cheerful, right? Those who were induced to smile felt happier and recalled happier memories than those who were induced to frown, okay? So your body posture and sort of how you apply yourself can affect as well your outcome, like how you feel, okay? So basic emotions that we've talked about are present in infancy, okay? But some emotions are a combination. So example, love is a mixture of joy and excitement, okay? The ingredients of emotion not only are a physiology and expressive behavior, but also your conscious experience. So it's that triangle, okay? So physiology, behavior, and cognition. So that triad, it keeps coming up, but that's really where, emotions are kind of in the center of. Okay. So I'm going to talk about just a few of these emotions in more detail, but your basic ones, okay? So fear can be poisonous, it can be contagious, okay? So we've talked in our last lecture about learning by observation. So you can learn to be afraid just because everybody around you is afraid and you don't know what they're afraid of, right? But you just know that they're afraid. So they go into this place, they're all afraid because maybe one of them, okay, had a negative experience. The others learned not of that experience, but they learned of the feeling, the fear. And so it's contagious, okay? So it is also adaptive. It prepares you to run from danger. So fear is essential, like not having fear. So when a mom tells me my child is impulsively fearless, that is really scary, because if they don't have that button, alarm system that says, you know what, if you jump off the 3rd floor, you're going to die. Okay. That is a cognition that goes with the fear. Okay. That's why kids get scared from what their mother does to them or to herself. So the example I probably gave you before is like when the child sees mom like react with a panic attack to a cockroach. And so, then the child becomes afraid of the cockroach. So I don't know if that's what you mean. So fear of injury protects us from harm. Fear of punishment protects us from harming others. Okay. Fear can help us focus on a problem. So you have an exam, you're afraid of failing. Okay. So you better sit and study. And so you kind of look at coping strategies, time management. But if you had that as absent, so people have exam anxiety. That's completely normal. If you don't have exam anxiety, I'm not sure. Like maybe you're super confident, or maybe you're somebody who's like studying, like timely, and so you don't have a reason to be afraid because you don't have a rush. You're never going to be squished for time. But I believe in medical school, there's no way. Like there's never enough time to finish everything. So fear it kind of goes hand in hand with being a medical student. But again, so there's a positive and there's a negative side to fear. Okay, learning fear. Remember little Albert, the little kid who started to fear white rats because it was coined with the loud noise. Okay, so you can be afraid of anything, and it really depends on the association, the conditioning. Okay, so when kids begin to crawl, all right, and then they start to fall, so then the near fall prevents them from, I've seen kids who like toddlers, like 1-year-olds who like fall, and then now they're afraid to walk because they don't want to fall, right? So, it's kind of working around this conditioning, okay? Because of conditioning, people can have a huge list of fears. You can see somebody who's afraid of, a billion things. And then learning by observation makes it longer, okay? So how, again, does learning, which is your cognition, spill over into, maybe actually making your physiological responses worse, so you can have more palpitations when there's really no need to, if your thought process was not distorted. So if you didn't have cognitive distortion. So we're biologically prepared to learn fears, okay, more than others. So again, monkeys learn to fear snakes by watching tapes of monkeys reacting fearfully to a snake. So they've done this experiment where the monkey looks at videos of monkeys reacting to snakes, but that monkey was never exposed to a snake, never, but they watched it. So then when they see a snake, it instills the same kind of, fear. We as humans learn to fear snakes, spiders, cliffs, all of these, more than things like cars and electricity, which are also high-tech dangers. Okay, but these are very primitive. So the learning fear lies in your amygdala, plays a key role in associating emotions and situations. So these associations, and again, bypassing the cortex, which will kind of do the reality testing, kind of the check on the feeling, amygdala just kind of bypasses. Okay. So imagine if this experimental blasts people with a loud horn after showing them a blue slide, because blue is supposed to be relaxing, right? So blue is the sky. It should not be a negative, but then they associate that with a loud sound, okay? So then they're going to react emotionally to this blue slide, and they're kind of measuring the electricity, looking at their, sweating. So perspiration, electrical conduction by perspiration. If there's a damage to this person's, okay, so these people are exposed to sound and blue image. If the nearby hippocampus was damaged, they're going to show the emotional reaction, but they're not going to be able to remember why. Okay. Is this this is conditioned. So this is conditioning. But if the damage was to the amygdala, okay, they'll remember the conditioning. So they're going to remember that, you know, there was a sound and there was a picture, but they're not going to show the emotional effect. There's not going to be the physiological response. Okay, so that's just telling us here that memory and the actual feeling. So different parts of the brain function for adding to, you know, different parts of the fear factor, fear experience. People with phobias have fears outside of the normal range. We know that. And obviously their fear disrupts their ability to cope. And so that's why it's a disorder. But some people thrive on risk. I don't know if you've ever come across people like, you know, and again, it's car race driving. So, you know, bungee jumping, things like that. I mean, they like the rush. So experiences can shape fearfulness and fearlessness. Okay, so the extremes, but also do genes that influence your genetic coding. Okay, so they've isolated the gene that influences the amygdala's response, and so people with a short version of the gene have less of the protein that speeds up the reuptake of serotonin. All right. And so with more serotonin that's available, they have an increased response to frightening pictures. So that's kind of the biological explanation, if you will, for why some people may react, you know, with more fear just because of the genetics. So they have more serotonin available. Okay, so therefore their responses are more intense. The causes and consequences of anger. So we're done with fear. We're going to look at anger. Okay. Obviously, anger can sometimes be more hurtful than the injury that it causes. So the anger in itself. And what makes you angry? Okay. So anger is a response to someone else's perceived misdeed. So somebody did you wrong. And so I perceive that they have done something wrong. And so I'm angry. Okay. So sometimes even small things make people angry. Like if you're driving and it's noisy, or and it's hot, if it stinks, really smells bad, or if you're in pain, all of these things can make you angry. So when I get a referral for agitation, so somebody's agitated, okay, when I'm on call, I cover all ages, you know, young, old, everything. So very often we get, you know, referrals because someone is agitated or they're pulling at something, okay? So you're thinking, are they delirious? You know, that's kind of the first thing that comes to mind. And delirium is a medical condition. So as I'm going to the ICU or ward, I'm thinking, you know, are this person's labs okay? You know, like the medical component. And then sometimes you go there and you're surprised that it is none of the above. So I remember once I saw this girl that would not let them touch her to do any investigations, and she would be like, you know, lashing out. She was angry, all right? And the simplest reason was that every time they wanted to do any kind of like put IV lines or whatnot, removing she was like a little girl, had a lot of hair on her arms. And so removing that bandage or band-aid was really painful. So the anger was not related to anything other than, you know, the process or the procedure. And again, pain is really essential. You know, when people are in pain, they're agitated, and it's simple as, you know, I tell my residents, did you ask about pain? What is the pain management? And this is not psychiatry. This is just very basic, you know, stuff. Anger obviously can be harmful because chronic hostility, you know, leads to heart disease, but also it affects relationships for sure if you're just an angry person. And so sometimes people will say, you know, you need to go get your anger fixed, get anger management, because it is harmful. Okay. So how do people react to, like, you know, anger? So boys more than girls reported walking away from situations that make them angry, or they work it off with exercise. So if they're really upset, they're going to like work it out. And so it just let it out of their, steam it off. Okay. Girls tend to like talk with a friend or listen to music to kind of deal with anger. In some cultures, venting rage is encouraged. Like you're really encouraged to kind of, you know, punch that, like the whatever bag, or punch that pillow, right? So vent your anger. It presumes that through aggressive sort of action, you can actually have this emotional release or catharsis, like you're releasing this anger, okay? But it usually fails to cleanse your rage. I mean, it doesn't treat the cause, okay? Why are you angry? It's not about like punch that bag and release it, but then you need to look at why, what is the cause? What led you to be angry? That's where the money is. Okay. So how should you deal with anger? Venting may actually provoke you to be more retaliation, and you can actually have a lot more escalation, okay? And so sometimes it makes it only worse. You know, hitting a punching bag, believing that it'll be cathartic can lead some people to exhibit more cruelty because you're hitting the punching bag. So when you're angry, you shouldn't try to vent. Again, it's like I said here, you're going to get like the pros and the cons of different ways. You need to do what works for you. Because sometimes people, when they vent it out, it just makes them feel better and they cry it out. I mean, some people just cry and just gone. Some people run and it's better. Some people meditate, some people pray, some people listen to music, some people, you know, jump the rope, whatever it is that makes you feel better, you do it. But if you're doing something, so if every time you're venting and it's not working and it makes you even more angry, then obviously that's not the correct method for you. You need to find something else. So what we're saying is different mechanisms. If you find that it's not cathartic, it's not going to help you, then just don't continue doing it. So when anger fuels physically or verbally aggressive acts that you're going to regret later, and it becomes maladaptive, then you need to abandon ship, okay? Sometimes they can temporarily calm the person, okay? All right, so you can. Sometimes it can calm the person, but then it could also be reinforcing a habit. So what is the best way to manage anger? Okay, so some people say wait. You can bring down this level of psychological arousal by just waiting. So when someone tells you breathe, so kind of breathe, take a deep breath, all right? And, you know, think. It's really allowing your cortex to kind of like get into action mode and think about like, do I really need to slap that person? Do I need to punch that person? Or you know what, I'm just gonna let it go. And you should deal with anger in a way that does not involve being chronically angry, okay? So you don't wanna be like just always angry, or that you sit there and you kind of rehearse all your losses and you ruminate, and so that makes your anger much worse, okay? I tell kids when they're upset to count and breathe. All right, so you kind of say, take a breath and count, but obviously not out loud because you don't want them to be ridiculed by others. So take a breath, count, and then maybe you can walk away from a situation. Sometimes works, sometimes doesn't, but worth a try. Anger can communicate strength and competence. So that's another, I'm going to take another 3 minutes. Is that okay? We're not going to be able to finish this lecture, unfortunately, because we still have a few more slides. So I'm going to find another hour some other time, or half an hour, but I'll just go for another like 2 or 3 minutes. So it can communicate strength and competence. I'm not sure what you guys think about that. It can benefit a relationship when it expresses the problem that can promote conflict like resolution. Okay, so it's not normal for someone not to be angry, okay? But anger can also be positive. It could move a group, all right, into changing behavior because something happened to this group that, you know, should lead to anger. And so this anger can sort of move people into making changes that are positive, okay? So it can communicate strength and competence because it means like, you know, this group is not going to be abused. It's not going to be okay with abuse. You know what I mean? So again, everything has its positive and its negative depending on context. Okay. So I'm just wondering how many slides we have left. Yes, we have probably like 7 slides. So I think I'm going to stop here. I'm going to stop at happiness, and I will find another hour to finish this and the last lecture with you guys. Thank you all for always being present and participating. You have been a great group. Have a great day.